Department of Health and Environment, and executives from our hospital systems, UCHealth and Banner Health. Today's panelists include Larimer County Public Health Director Tom Gonzales, Erika Cathey, the Communicable Disease and Emergency Preparedness and Response Manager here at the Health Department, Dr. Paul Mayer, Medical Officer for Larimer County, Alan Qualls, CEO and Banner, Healthcare's North Colorado region, and President and CEO of UCHealth's Northern Region, Kevin Unger. There will be some time at the end of the presentation today for questions, and some media have sent some questions ahead of the webinar that we will do our best to answer. Folks can also use the Q&A feature in Zoom to put questions in there at any time, and we'll do our best to get to all of those. If you have questions after the webinar, you can send those to healthcommunications@larimer.org, and we'll follow up that way. So now I'm going to turn it over to Tom.
Yeah, good morning. Thank you, Corey. And thank you, everyone, for joining this community update, which is really intended to raise awareness about the common respiratory illnesses currently circulating and to provide information and reminders to help individuals in Larimer County prevent the spread of these viruses. We will be making some recommendations for staying well and slowing the spread of the viruses. A big thank you to Kevin Unger and Alan Qualls from UCHealth and Banner Healthcare for joining us today in their ongoing partnership. As a public healthcare system, we work very closely together, and we appreciate their representation. We also appreciate CDC and the State Health Department for putting together what we call Essence data systems that came out of the COVID pandemic, where now we get data weekly on what are people going to the emergency departments for. So we can see these trends, and when we see a trend, we want to make sure we're being health strategists and getting this information out to the community so that they can make those decisions to keep their loved ones and friends and others healthy for this season. So with that, I will turn it over to Erika Cathey, who will give us an update on some of the data that we're seeing from our hospitals. So Erika.
Thanks, Tom. So as Tom mentioned, we do receive data, very timely data from our healthcare systems. And what you'll see here are emergency department visits. So individuals who presented to an emergency room and may or may not have been admitted to the hospital. And then on the right, we have folks who were indeed hospitalized for COVID, flu, or RSV. If you look back to the graph on the left, a big concerning trend there, COVID-19 has accounted for the majority of ED visits that we see in our data compared to flu and RSV. However, you'll notice toward the end of November, we started to see a pretty dramatic increase in our visits related to influenza. We're still seeing, back to the graph on the right, COVID still does account for the majority of hospitalizations, but we are starting to see that increase in RSV and flu as well. I will say this is in line with what CDC modeling predicted for this season. They did predict a moderate COVID, moderate RSV, and moderate flu seasons. However, they did caution, and I think this is what we're seeing, that just the addition of COVID-19 to our typical RSV and flu seasons creates a strain, and of course, concern about all three viruses peaking at the same time, which is why we're having this call. And I want to turn it over to Dr. Mayer to talk a little bit more about prevention.
So we always like to emphasize for prevention, just basic good health. We learned, and I think it was kind of highlighted with COVID, that basic good health is very important. So getting good rest, getting good nutrition, regular daily exercise. We saw things like that really impact hospitalization and death rates from COVID. And then, of course, again, in a public health way, we want to really promote vaccinations. We have some excellent tools to help prevent these diseases or to decrease the impact of diseases, even if you do get them. With regard to the flu vaccine, it's recommended to everybody 6 months and older who doesn't have a contraindication of flu vaccine. We have some nice data out of the Southern Hemisphere that suggests that it's about 50% effective at preventing hospitalization, which is really excellent. With regard to COVID-19 vaccines, the current vaccine we have is based on the XBB 1.5 variant. And we have some good studies on that as well. We have neutralization studies to suggest it should remain very effective at the currently circulating variants. And we have some vaccine effectiveness studies, early data. Those studies take some time to get, so our data is not perfect, but it looks like the current vaccine is roughly about 50% protective on hospitalization and about 60% protective from death from COVID-19. So again, a highly effective vaccine and very safe. RSV vaccines are new and excellent vaccines as well, indicated for people 60 and over, and on a conversation with your personal care provider, and also for pregnant women now at the end of pregnancy. The vaccine effectiveness for people over 60 is excellent, around 80% protective against symptomatic disease the first year after the vaccine. The idea for maternal vaccination is if we can vaccinate the mom, she'll make antibodies. Those will cross the placenta and protect her newborn. And the data on that is also very encouraging, 57 to 68% protection of newborns in the first 6 months of life. And in particular, 69 to 87% protection against severe disease, again, in the first 6 months of life when the infants are most vulnerable to RSV. We do have a new monoclonal antibody, nirsevimab, for infants and young children. That has been in somewhat limited supply, so there's been some access issues for that. And so we are very much encouraging maternal vaccination rather than the use of nirsevimab for the general population. Nirsevimab is being reserved for infants at particularly high risk and the youngest of the infants under 6 months. We ask folks that if you do become ill, use common sense, stay home at least 3 days. Make sure to cover your mouth and nose with cough and sneeze. And we do still encourage masking when ill. Thank you. Next slide. And then again, just on the prevention front, frequent hand washing, covering cough and sneeze, masking. One thing is definitely to contact your medical provider if you become ill. We are seeing a continued significant underutilization of very effective therapeutics to fight these things. Paxlovid for COVID is a very effective intervention. The majority of people who get COVID-19 do have an indication to take that medication. And unfortunately, we're seeing it's very underutilized. And influenza also has effective therapeutics, in particular for children. And so we really want folks to talk to the medical providers when they become ill and get guidance. Thank you.
Thank you. I'm going to go ahead and turn it over to Alan Qualls with Banner Healthcare to just give us a general update on what they're seeing in hospitals this busy respiratory virus season.
Thank you, Corey. In general, we are seeing kind of what everybody is seeing in the community. Certainly, it's an elevated rate of infection from COVID and flu and some of these other things. But when you look at actual number of hospitalized patients in our 3 hospitals in Northern Colorado, we have less than 10 patients. And of those, typically all of them are probably age 65 and older with other underlying health conditions. So it's very similar to what we've seen really throughout this kind of the tail end of the pandemic.
Thank you. I'll turn it over to Kevin to give us an update on what UCHealth is seeing.
That sounds great. Well, thanks, Corey, and happy holidays to Larimer County. We very much appreciate y'all. We are seeing a slight uptick as well in the respiratory issues. We made it through Thanksgiving relatively unscathed, and so we didn't see a whole lot of activity at that point. But the last couple of weeks, we're starting to see an uptick. We are certainly always ready to be busy in December, so people are starting to bump up on their deductibles, and they're trying to kind of squeeze in a lot of their elective procedures before the year ends. We are fully staffed, and we've been able to really handle this year's kind of surge of respiratory issues, and so we feel very blessed on that front. And so everything seems to be in order. Our EDs are extremely busy. We're seeing a multitude of different issues through the emergency departments, but overall very manageable within the UCHealth system. And so with that, I'll go ahead and turn it back to Corey.
Thanks, Alan and Kevin. A couple questions came in, and I think that you answered some of the information that was asked, but another part of it is, are the COVID-19 cases that you're seeing less severe now than those you were seeing in 2020 and 2021?
Yeah, I can take a stab at that. And I think Alan hit upon it. We're seeing it's still having an effect on those that are somewhat more in our senior population and those with other conditions underlying COVID-19. But overall, the general population that are contracting COVID-19 are not being hospitalized for the most part. Just feeling a little bit miserable, but mostly being treated at home.
I would add very similar. Again, I think what we're seeing is much like we've seen really for the last 2 years. Since it's an Omicron strain, it's, most individuals have fairly mild symptoms. A few here and there have some more severe ones. But again, that's kind of our experience here at Banner.
Thank you. All right, I'll move to a few other questions that came in, and this one is timely, and I will give this one to Tom. Should people avoid large holiday gatherings, bringing together people of all ages from multiple households?
The answer is no if you feel well. If you are ill or have been ill, let's follow the doctor's good recommendations and unfortunately stay away for those up to 3 days after symptoms, depending on the illness and certainly the severity. And definitely frequent hand washing and covering coughs and sneezes. And if you can't get vaccinated, if you're able, it's never too late to get vaccinated. Please get vaccinated. But no, we are social creatures. We went through a hard time with the pandemic. It's just making those good decisions based upon your health and your family's health. But we encourage folks to get together and celebrate with family and friends.
Thank you. I'm going to send this one to Dr. Mayer. With COVID-19 cases rising, are those who did not receive vaccines proving to be more vulnerable to infection than those who did? Is there any evidence locally that boosters have been effective?
So mostly what we have is state or national data. It can be hard to collect local data because that's not necessarily reportable. But overall, yes, the numbers I mentioned earlier, if you've got the vaccine, then you're less likely to be hospitalized, less likely to die of COVID. So we are seeing that the vaccine is being effective this year.
Great. Dr. Mayer, are some people coming down with multiple illnesses, say influenza and COVID-19 or RSV and COVID at the same time?
Yeah, that is being seen. And unfortunately, we have evidence, a little older evidence, that when you're co-infected, you are more likely to have a worse outcome. Yes, so the answer to that is yes, we do see that. And
then is there different recommendations for each of these viruses as far as prevention or, how long you should stay away from other people?
Yeah, the general recommendations are going to be the same as far as obviously when you're ill, avoid contact with others. Some of them, like COVID, it's recommended still recommended you stay home for 5 days if you have COVID from symptom onset. And then if you're out in the public after 5 days, that you wear a well-fitting mask. And that's more of a COVID specific guideline. As far as the other viruses, like influenza, you tend to be non-contagious 24 hours after your last fever, same with RSV. But overall, the broad guidelines are very similar.
Great. And then another one for you, Dr. Mayer. Why is RSV more serious for seniors and for young children?
Some of these things we don't have specific answers for. As far as elderly, we know your immune system and your general state of health, your heart, your lungs tend to be worse as we age. And that's probably why many things like influenza and COVID and RSV affect the elderly more. As far as children, sometimes that's hard to know. For instance, as we all know, COVID has been less severe in children, whereas influenza and RSV are much more severe in children. And some of that we don't have great answers for, to be honest, in particular on the child side. The elderly makes more sense because of, like I say, comorbid conditions like heart disease, lung disease.
All right. And then there was a question about coverage for vaccines, if it's covered by Medicare specifically. I can answer that. It's our understanding that Part D of Medicare does cover recommended vaccines, but we always recommend that someone talk with their healthcare provider, check with their health insurance. Here at the health department, we can provide vaccines for individuals who do not have health insurance or who have insurance that doesn't cover vaccines in most cases. So that is the answer to that one. And let's see. I think one of the final questions I got ahead of time, and then I'll check if anyone's put any in the Q&A in the Zoom call. Dr. Mayer, what are the side effects of these vaccines?
So similar to what we've been seeing in the past, so common side effects would be headache, achiness, sometimes low-grade fevers, fatigue would be some of your more common side effects from any of these vaccines.
All right. I am not seeing any questions in the Q&A. Tom or Erika, is there any additional information you want to add for our update today?
I just want to add thanks for everyone for participating and listening in. And I do see there might be a question now in the Q&A.
Yep, I do see one. So we'll go back to that. Let's see. I work in a large childcare center, and I'm wondering about children testing positive for RSV. Is it a recommendation for them to stay home 3 days? And that's probably a good one for Erika.
Yeah, thanks, Corey. So flu, RSV, and COVID all have different recommendations as far as how long folks should stay home. For RSV and flu in particular, we ask that children stay out at least 24 hours fever-free without the use of fever-reducing medications. So that's kind of the general guideline. Of course, for COVID, if they're positive for COVID, the recommendation is 5 full days of isolation, followed by masking for the additional 5 days. And if that's not possible, 10 days of isolation. So each one's a little different. And I have a resource I can share specifically for schools and child cares that go through each disease and the exemption for each of those.
Great. And another question had come in, but she said you just answered it. So I'm not seeing any additional ones. So I'll turn it back over to Tom to close us out.
Well, again, thank you, everyone. And thanks to our child care centers and schools. I know these are always challenging times, and thank you for your questions. It is kind of confusing there as we try to make sure we're staying healthy during this flu, RSV, COVID season. A big thank you to our hospitals and all they do every day, making sure keeping us healthy. So thank you to Kevin and Alan's teams at our hospitals for their great work. I will say things are a lot different than before the pandemic, and they've been able to adjust, pivot, and transform their hospitals. So even with these 3 peaks coming together, they are busy, but they have the staffing and they have the appropriate facilities to manage good quality care. So thank you, Alan and Kevin, for all of that work. And thank you, community, for all you do to keep our community going and staying healthy. So thank you, and everybody, happy holidays.
Thanks, everybody. The recording for this will be available on our YouTube page, and for childcares and schools, if you're interested, or anyone who's interested, you can email us directly at healthcommunications@larimer.org, and we can send you any follow-up information and the link to the recording.